Good morning, everyone. My name is Guy Bernisti. I'm a product specialist with surgical science, and I want to present a few simulators for you today. The first one we're going to present is the Robotics Mentor. And on the screen is one of our most advanced procedure, which is the radical robotic prostatectomy. This simulator mimics the ergonomic environment of working on the real robot, where the doctor's console, you have to put your head in, and only by that I can actually work with the pinchers and actually start the procedure on the screen. The idea here is to actually go through a full procedure and go through the procedure step by step of very, very complex robotic procedures. In this case, prostate cancer is one of the leading causes, or one of the leading cancers in the United States. And basically what we do is we teach them on the anatomy exactly, using visual cues and educational aids, how to use this robotic, how to get accustomed to the robotic environment, because this is a much more complex system than the open surgery or the minimal invasive system procedures that we use today. This allows them to practice all the robotic surgical skills, from handling the camera, clutches, the depth perception, and of course understanding the difference between open surgery and robotic surgery and laparoscopy. There are multiple cases on the simulator. Of course, we have general surgery, we have gynecology, and we have a wide range of basic skills that you can work on the simulator, mimicking the entire environment of the robot itself. Okay, the next simulator I'm going to present is our EndoSuite. The EndoSuite is a phenomenal development that came after years of effort, where we took 4 different simulators and combined them into one platform. The main role of the EndoSuite is pretty much to cover everything which is flexible and rigid endoscopy, starting with the GI endoscopy, the endourology and the bronchoscopy, the hysteroscopy and the TURP, and of course we do have the rigid scopes in the drawer, that these are for the endourology simulation. So 4 different platforms on the same, 4 different simulators on the same platform allows the sim centers, to get a machine which covers so many curriculums. And what we do is we actually change the cartridge. This is the GI, so this is the upper GI and the bronchoscopy. This is the lower GI and the colonoscopy. This is the endourology mannequin. And this is the hysteroscopy simulator, the HIST sim as we call it, using real medical devices that are modified for the simulation itself. So this is a resectoscope, so basically mechanically everything works, and you will see that on the simulator in a second. So what we see here, and this is a very nice example of a case which is very, very complex. This is a myomectomy case where there is a very big benign tumor that we actually have to resect it very, very slowly by using what we call a resectoscope. And just like in real life, it creates bleeders, it creates complications that need to be monitored very, very closely. There are a lot of technical functionalities that we can do by changing the camera angulation, and this is a very important feature, if you look at the screen, you see the inlet and the outlet valves moving. This is how the doctor controls the fluid management inside the system. Otherwise, it can create a lot of complications and pressure. We do have some nice features where I can have the clear view, where it keeps the environment clean, or if I remove it, you will start seeing the visual getting a little bit more blurry, just like in real life. And the way they actually control this is by actually allowing more fluids into the system to wash all that stuff out. And I do have a meter here which will tell me how much of that myomectomy I actually managed to remove without causing any damage. If I go a little bit too deep, this can create other issues. And what I have to do at the end is actually scoop those fragments out through the cervix, and then of course get rid of the specimen, make sure I leave a clean environment without any fragments left, any active bleedings. We have a variety of different cases like polypectomy and diagnostic and myomectomies, and of course this simulator will expand in the future. Another very important aspect of the simulator, or all the simulators of course, is not just the hands-on training, but it's the feedback that we provide the doctors and the users at the end. The feedback itself, the performance report, does not say anything about good or bad. These are objective and technical information that allows the faculty to judge whether or not the training was actually doing a good job. Some of these features will have graphic analysis, which will allow the student to get that immediate feedback. And of course, will actually allow the doctors to get that as well. This is the GI Mentor simulator that we have. So the 4 simulators are right here. So the GI Mentor focuses on upper and lower GI cases. And of course, we have some of the more advanced cases like ERCP, endoscopic ultrasound, and EMR ESD, which is the latest one. Then we have the EuroMentor, which is purely endourology, which focuses on basic skills, stone manipulation, strictures, and of course a TURP, which is one of our latest addition. We have the bronchoscopy simulator, which focuses mostly for those who are interested in checking the lungs, of course, and the bronchial tree using the flexible endoscope. We have diagnostic, we have essential EBUS, and of course we have the emergency bronchoscopy, which this is cases where kids swallow foreign objects and we have to remove them in a very, very fast manner and of course in a very safe manner. The Mentor Learn itself is a product on its own, allows the sim centers, managers and the educators to control a large number of users on the simulator through the user interface. Through the users and groups, you can log in your students, you can group them based on their level, whether they're first year, second year, third year nurses, research techs, it doesn't matter. And of course, this is how we control. Every group will be assigned their own training programs and their own homework.